A friend was recently rushed to the hospital in the middle of the night. It was an emergency. A cousin and I were informed, and we went to the hospital to see him. We got there and found the medical team attending to him. He suffered from AMI, acute myocardial infarction, the doctor said. I nodded in understanding. Seeing the confusion on my cousin's face, I quickly chipped in, mildly put, he had a heart attack. My cousin, still looking confused, asked, so why did she say acute myocardial infarction though? So, if you're watching this video right now and trying to figure out what AMI means, stay tuned for a clear explanation.
Welcome to Simplified Health Tips, your place for factual information about achieving and maintaining optimal health. I'm Michael. Today Russell and I will be covering everything you need to know about acute myocardial infarction, including its causes, symptoms and treatment options. So, tap the like button, smash that subscribe button and let's go. Okay Russell. Let's start with the basics. What is acute myocardial infarction?
If you are called to explain what acute myocardial infarction is to someone who is not in the medical field, you will have to simply define it as heart attack. A heart attack is the reaction of the heart to a disruption in blood supply to the heart. What this means is that the vessel that supplies blood to the heart, known as the coronary artery, gets blocked. This blockage stops the flow of blood to the heart in such a way that the muscles of the heart are damaged or badly affected. The coronary artery supplies oxygenated blood to the heart. The blood supplies oxygen and other nutrients which gives the heart the life needed for it to function properly. A blockage, therefore, means that the amount of oxygen the heart receives will be greatly reduced, thus hampering the function of the heart. And that is what acute myocardial infarction means.
What are the symptoms of acute myocardial infarction?
Acute myocardial infarction is sudden, but there are warning signs and symptoms to watch out for. These symptoms include shortness of breath, dizziness, sudden pain, pressure or tightness in the chest or upper arms that may spread to the chin, back or neck which may be constant or recurrent, nausea and vomiting, heartburn and abdominal pain, cold sweats, anxiety, and fatigue. Although the above listed symptoms are indicators of acute myocardial infarction, these symptoms vary between individuals. The severity of these symptoms also vary from extreme pain to mild pain to no pain at all in some cases. In some other cases, the individual's heart might suddenly stop beating, a situation known as cardiac arrest. It is important to note, however, that the existence of one or more of these symptoms, and its increasing severity, is a sure sign that an individual might be having a heart attack. Acute myocardial infarction is mostly sudden, but the symptoms and warning signs are usually not. A lot of people who experience heart attacks most likely experienced some symptoms a few weeks, days, or hours before. The most common symptom experienced that might be an early warning of an incoming heart attack is pain or pressure in the chest or arm that comes and goes. This pain, which is caused by a reduction in blood supply to the heart, comes with intense activity or stress, and eases with adequate rest.
What should I do if I am or someone around me is exhibiting symptoms of acute myocardial infarction?
If you are experiencing one or more of these symptoms, it is very important that you act immediately. It becomes quite dangerous when you wait even after having the symptoms, no matter how mild. Things you can do to save time and save yourself when having a heart attack include: call for help immediately. With heart attacks, delay is extremely dangerous. If you notice that you might be having a heart attack, quickly dial 911 or the local emergency number closest to you. If you know that access to an emergency hospital care is low, ensure that someone takes you to the hospital. It is highly unadvised that you drive yourself to the hospital, as you might slip out of consciousness during this period, which could pose a higher risk to you and those around you. Therefore, drive yourself to the hospital only if you are totally sure that there are no other plausible options. Take drugs that are prescribed by the doctor. Drugs like aspirin and nitroglycerin can help reduce the severity of the heart attack. For example, aspirin helps to prevent further damage to the heart by keeping the blood from clotting and blocking the coronary artery some more. However, do not take these drugs without medical advice, as they have contraindications that can interfere with other medications. Another thing to note is that you must never delay in calling for help because you want to take the meds. Remember, delay is costly. On the other hand, if you see someone having a heart attack, there are also things you can do to help the person stay alive. Do not waste time in calling for help. Check if the person is still breathing or not. If the person is not breathing, check if there is any obstruction in the airways. Then you can begin cardiopulmonary resuscitation, more commonly known as CPR, to get the person's heart to start beating again. To carry out CPR, press the chest with some force and rapidly, in a consistent rhythm, up to 120 compressions per minute. Ensure that you have called, and you are sure that help is on the way though. This is more important.
So, what are the causes of acute myocardial infarction?
When the cause of acute myocardial infarction is known, it becomes easier to prevent and manage. Acute myocardial infarction occurs when a coronary artery gets blocked. This could be as a result of certain things, which include atherosclerosis. This basically means hardening of the artery, and it is caused by accumulation of fat, cholesterol, and other fatty deposits called plaque. The more plaques that are present in an artery, the narrower the artery becomes. This leads to a decline in function of the artery, a condition known as coronary artery disease. Coronary artery diseases more often than not cause heart attacks. Ischemia. Ischemia occurs when there is a reduction in the amount of oxygen and nutrients that the heart receives. Plaques can cause ischemia, but they can also break down and cause a flood of cholesterol, fat, and unwanted substances into the bloodstream. This will interfere with the oxygenated blood, forming a blood clot that can also block the artery if it increases in size. This blockage can be total, leading to an ST segment elevation myocardial infarction or STEMI, or partial, leading to a non-ST segment elevation myocardial infection or STEMI. Arterial spasm. This is another cause of heart attack, and it happens due to the use of illicit drugs and tobacco. Spasms of the coronary artery can prevent the flow of blood to one or more heart muscles, which can be fatal. Complications from COVID-19 can also cause heart damage and heart attacks.
Please tell us about the risk factors that may lead to developing acute myocardial infarction.
Certain things can cause you to be predisposed to acute myocardial infarction, and these include smoking and use of drugs. You're at a higher risk of having a heart attack if you smoke or are exposed to passive smoking for a long time. Use of illicit drugs can cause a heart spasm, which is a cause of heart attacks as well. Obesity. Atherosclerosis is majorly caused by fat and its deposits. This is why obesity is a major risk factor for having a heart attack. This can be prevented if you lose up to 10% or more of your body weight. Age. Simply put, the older you get, age 45 for men and age 55 for women, the higher the risk of having a heart attack. Hypertension and diabetes. Hypertension and diabetes can cause damage to the coronary arteries, which poses a higher risk of having a heart attack. A combination of these with obesity leads to what is called metabolic syndrome. Metabolic syndrome puts you at a risk of having a heart attack, 2 times higher, or heart disease than if you do not have it. Family history. There is a chance of having a heart attack if someone related to you has had it before. Sedentary lifestyle/stress. Exercising regularly makes you healthier and fit, compared to being inactive. Inactivity can also lead to obesity and high blood pressure. On the other hand, stress can increase your blood pressure, which can also lead to heart attacks. Complications from other heart diseases. If you have had a heart attack before, chances are that other heart diseases can develop. These diseases usually include irregular heart rhythm, known as arrhythmia, heart failure caused by death of one or more heart muscles, etc. These diseases can lead to cardiac arrest, which is quite fatal in many cases.
How is this condition diagnosed?
Heart attacks are diagnosed through a series of confirmatory tests to check for regularities, or otherwise, in heartbeat, heart rhythm, and blood pressure. Major tests that are used for this diagnosis include electrocardiogram, EKG, echocardiogram, ECG, and certain blood tests. Sometimes, a stress test or an angiogram is also used.
What are the treatment options available for some who suffered an acute myocardial infarction?
Like I have said before, time is quite important when it comes to heart attacks. Treatment of heart attacks are immediate and depend on the type of heart attack, but the possible treatment routes include use of stents and angioplasty. This is basically a procedure that involves placing an inflatable tube through a catheter into the artery to stop the blockage and open the artery for blood flow. In place of the inflatable catheter, a wire mesh tube, called a stent, can be used. Medication. There are a range of drugs that are used to treat acute myocardial infarction, ranging from drugs that make the blood thin in order to dissolve and prevent clots, e.g. aspirin, clopidogrel and thrombolytic drugs, to drugs that enlarge the blood vessels, lower blood pressure and stress on the heart, such as nitroglycerin and beta-blocker drugs, among others. Pain relievers are also used to ease pain during heart attacks. Coronary bypass. This is also a procedure that diverts blood flow around the site of the blockage. It is usually carried out after a heart attack to give the heart enough time to recuperate.
What can we do to prevent having an acute myocardial infarction?
You can prevent a heart attack even if you have had one before. Some of the simple ways to do this include using prescribed drugs at the right time and the right way. This is especially important in preventing a further heart attack if you have had one before. Ensure that you also visit your doctor regularly for checkup. Live healthy. This cannot be overemphasized. Regular exercise, eating healthy, having good sleep, as well as avoiding smoking, alcohol, and use of illicit drugs will help you have a healthy heart and reduce the risk of you having a heart attack. In all of this, do not forget that time is an important factor in both preventing and treating acute myocardial infarction.
Thank you again, Russell, for helping our viewers better understand acute myocardial infarction. To our viewers, remember to share this video with someone who may benefit from the information. Also, leave your feedback and topic suggestions in the comments section. See you next time.
Thank you for watching to the end of our video. If you found the information helpful, please like the video. Also, don't forget to join the family by subscribing to our channel. See you next time.